1. The Old Killer, rabies. Among the first virus diseases is rabies. Mesopotamian historical records from 2300 BCE detail a mystery ailment infecting people and animals, usually connected to rabies from animal bites. The signs of rabies, hydrophobia, exhilaration, almost certain death, frightened mankind for millennia. Rabies is still a global killer, even though post-exposure treatment and vaccine efforts can help to avoid it. According to the World Health Organization, 59,000 people die from rabies every year, mostly in rural Asia and Africa, where medical treatment is rare. Although not in charge of pandemics, this ancient virus helped clarify zoonotic transmissions and the need of animal vaccination campaigns. Some viruses have dogged society for millennia and call for constant protection and treatment. 2. The New World smallpox epidemic, 1519 to 1520. Early in the 16th century, European adventurers brought a virus native to Europe to the Americas, for which indigenous people lacked readiness. Between 1519 and 1520, variola virus caused smallpox rapidly swept over local communities. This epidemic changed the demographics of the New World and destroyed civilizations, killing 5 to 8 million people. The terrible fatality rate, which in some areas reached up to 90%, cleared the way for European colonization and conquest. The first vaccinations were created following smallpox's devastation of the planet, a public health success that resulted in its eradication in 1980. New World smallpox underlines the significance of immunity and vaccination in preserving populations and shows how one virus might change history. Third American measles epidemic, early 16th century. Like smallpox, measles ravaged Aboriginal people following European arrival. Highly contagious, measles spreads rapidly in recently established towns. Vaccination stops modern measles, but early 1500s catastrophic outbreaks among Aboriginal people resulted from their lack of protection. In other places, measles brought a 90% population drop over a few years. Millions of indigenous people perished, and whole civilizations were altered, even if the exact numbers are unclear. This catastrophe taught the next generations about immunization and transformed the socioeconomic structure and demography of the Americas. The epidemic of measles keeps teaching us about sickness, immunity, and social collapse. Fourth poliovirus epidemic, 1916, United States. Early in the 20th century, poliovirus turned into a major threat in developed countries. Thousands of U.S. youngsters and young adults suffered poliomyelitis in 1916, which set off fear. Attack on the neurological system by the virus resulted in extreme paralysis and death. That year, polio claimed almost 7,000 lives. Many of the survivors were permanently crippled. Even developed cultures are susceptible to viruses, as demonstrated by the outbreak's unpredictability and suddenness. Vaccine research was born out of public health experts racing to grasp the spread of the disease. Vaccine advances had virtually eradicated polio in many nations by the 1950s, proving the life-saving power of scientific creativity and coordinated public health campaigns. 5. Spanish flu, 1918 to 1919. The worst viral epidemic, the Spanish flu, tore over the globe in 1918 to 1919. Comprising the H1N1 influenza virus, this epidemic claimed 50 to 100 million lives annually and affected 1/3 of the world's population. A cytokine storm caused the Spanish flu to strike young people, as well as the elderly and the healthy. Its spread was hastened during World War I by crowded military barracks and inadequate sanitary facilities. Societies carried the virus via quarantine, isolation, and cleanliness, even without immunizations or antivirals. The Spanish flu changed public health policies worldwide and advanced vaccine development and epidemiology, therefore opening the path for present influenza prevention and control. Sixth Asian flu, 1957 to 1958. Originating in East Asia in 1957, the new influenza strain H2N2 spread over the Asian flu epidemic internationally. 1 to 4 million people died worldwide from this epidemic. Why? Rising air travel and world trade helped the virus travel from China. To stop transmission, health officials swiftly instituted public information campaigns and new vaccinations, as well as quarantine. The Asian flu was less severe than the Spanish flu, but it highlighted the need for speedy vaccine development and worldwide collaboration. It also highlighted virus evolution and transmission, which now are crucial for controlling seasonal and epidemic influenza. The Asian flu was a significant event in 20th century public health, highlighting the resilience and vulnerability of modern society to new viruses. Hepatitis B virus, discovered 1965. Cirrhosis and liver cancer, can result from chronic liver infection brought on by the hepatitis B virus, HBV. One of the deadliest viruses, HBV, has silently been present even during smallpox and influenza outbreaks. Known since the 1960s, hepatitis B kills 880,000 people yearly. Since the virus is transmitted by blood or bodily fluids, it is a main public health concern in places lacking hygienic medical standards. Now included in worldwide newborn immunization programs, the 1980s discovery of an effective vaccination has significantly lower new infections. Although ongoing vaccination and treatment campaigns show the life-saving potential of modern medicine and public health, chronic hepatitis B still ranks as the main cause of liver disease. 8. Marburg virus outbreak, 1967. Almost simultaneously in laboratories in Marburg, Germany, Frankfurt, and Belgrade in 1967, the Marburg virus, a Filoviridae family member strongly associated with Ebola, emerged. Only 31 cases were reported during this outbreak, yet the virus claimed the lives of 88% of those who were ill. Fruit bats carry the Marburg virus, which causes high fever, major bleeding, and shock. The startling epidemic shocked researchers and resulted in better lab biosafety all around. The brief Marburg virus epidemic spurred important studies on filoviruses, diagnostic testing, and outbreak control strategies, and demonstrated the awful potential of fresh zoonotic viruses. We still use Marburg techniques to treat highly dangerous viruses with pandemic potential. 9. Hong Kong flu, 1968 to 1969. 1 year following Marburg, the 1968 Hong Kong flu, brought on by H3N2, struck. This worldwide epidemic claimed 1 million deaths. Using contemporary transportation, the disease traveled over continents in weeks from Hong Kong. Though its death rate was less than that of the Spanish flu, public health problems were raised by the fast worldwide dissemination of the Hong Kong flu. Its effect was lessened by better hospital treatment, new antivirals, and public awareness. The Hong Kong flu demonstrated how even a milder pandemic influenza strain may compromise the world economy and daily living. Setting the foundation for future influenza readiness, the management underlined the need for timely vaccine development and effective global communication. 10. Norovirus, first described 1972. First found in 1972, the winter vomiting bug, norovirus has caused severe acute gastroenteritis outbreaks. Because norovirus is resilient on surfaces, it spreads rapidly in closed environments such as cruise ships, colleges, and nursing homes. While the young, old, and those with impaired immune systems can die, in healthy adults it causes self-limiting sickness. Norovirus kills over 200,000 individuals a year. Public health policies including food safety, hygiene, and epidemic response define norovirus control. Notwithstanding these initiatives, norovirus is still one of the most often occurring causes of infectious gastroenteritis globally, which emphasizes the need for fundamental hygiene in public life. 11th, HIV/AIDS, 1981 present. Emerging in the early 1980s, HIV, the virus causing AIDS, became a worldwide pandemic killing 36 million people. Unlike the flu epidemic, HIV steadily compromised the immune system over the years. Originally unknown and stigmatized, the disease generated major scientific research and public health crises all around. Though its generally fatal character, the mid-1980s development of antiretroviral medicine made HIV a treatable chronic illness for millions of people. Medical advancements notwithstanding, new infections arise particularly in underdeveloped regions. HIV/AIDS's long-term consequences have shifted public health objectives, driven hitherto unheard-of global cooperation, and underlined the need for education, prevention, and treatment in the fight against a virus that millions of people annually affect. 12th, hepatitis C virus, discovered 1989. The bloodborne virus hepatitis C, which affects the liver, was discovered in 1989 and quickly rose to the top of worldwide health concerns. Although antiviral therapy developments in the previous 2 decades have revolutionized treatment, hepatitis C has no vaccine. Over 95% of cases can be treated with these new medications, dramatically lowering the risk of cancer and liver cirrhosis. Hepatitis C kills 400,000 people yearly, even with these advances. In low-income neighborhoods, dangerous medical treatments and contaminated blood transfusions discreetly spread the infection. The story of hepatitis C reveals how a persistent illness may destroy public health and how modern medical science might treat a once debilitating condition. 13th, hantavirus outbreak, 1993, United States. In 1993, the Four Corners area experienced an unusual outbreak of hantavirus pulmonary illness. Spreading by rodent dropping dust, hantavirus caused a severe respiratory infection with a 40% case fatality rate. Though the 34 deaths of the outbreak were small compared to world pandemics, its quick start and high fatality rate attracted attention. The main reservoir identified by fast epidemiological studies was the deer mouse. Public health officials used rodent control and public education to stem the spread. This episode reminded us that even little outbreaks can be fatal when a virus moves from animals to humans, therefore stressing the need for environmental cleanliness and zoonotic disease surveillance. 14. SARS, 2002 to 2003. Emerging suddenly in southern China in 2002, severe acute respiratory syndrome, SARS, caused 8,000 people to be sick, and 774 died from SARS, which was brought on by a novel coronavirus. Despite the fact that the number of patients was relatively small compared to other pandemics, SARS' fast spread and strong fear factor rocked global markets and international travel. Authorities used stringent quarantine, contact tracing, and international cooperation to suppress the outbreak. The experience demonstrated the need for honest communication and prompt public health reactions to newly arising viral hazards. Applied to later coronavirus events, SARS taught outbreak management and infection control. Its legacy impacts public health strategies and readiness for worldwide developing respiratory viruses. 15th, chikungunya virus outbreak, 2005 to 2006. In 2005 and 2006, chikungunya swept across areas of India and Indian Ocean islands, like Réunion. Spread by Aedes mosquitoes, this virus produces sudden high fever, extreme joint pain, and months-long fatigue. Although its morbidity is high, chikungunya hardly kills. The outbreak in the Réunion claimed 200 lives. The fast spread of the virus in heavily inhabited tropical areas revealed the vulnerability of communities to mosquito-borne diseases. Public health projects lowering transmission included vector control, education, and community involvement. Lessons still vital in combating other arboviruses in a warming environment, chikungunya pushed health authorities to increase surveillance and mosquito control. 16. MERS, 2012. Emerging in Saudi Arabia in 2012, the Middle East Respiratory Syndrome, MERS, coronavirus, stunned the international medical community. Although MERS has not started a pandemic, its 35% fatality rate and tendency to transfer from camels to humans create great concerns. Ever since its discovery, MERS has claimed 900 lives worldwide. Its transmission is mostly limited to close contacts and healthcare environments, enabling rigorous infection control. MERS emphasized the significance of linking human, animal, and environmental health in the management of diseases. Constant surveillance and study of zoonotic spillover occurrences is necessary to prevent MERS and related viruses from spreading internationally. 17th, Ebola virus outbreak, 2013 to 2016, West Africa. Between 2013 and 2016, West Africa saw the biggest Ebola epidemic in history. The filovirus Ebola, which causes severe hemorrhagic fever, claimed around 11,325 lives, mostly affecting Guinea, Liberia, and Sierra Leone. The epidemic taxed local medical systems and spurred a worldwide reaction. One of the most dreaded viral diseases is Ebola, with a high death rate usually exceeding 70%. Global community education, fast diagnosis testing, and experimental vaccines all helped to limit the epidemic. The Ebola epidemic brought attention to global health initiatives and healthcare facilities in vulnerable areas. Its legacy shapes vaccine research and the reaction to hemorrhagic fever. 18th, Zika virus outbreak, 2015 to 2016. Long limited to Africa and Asia, the Zika virus expanded globally in 2015 to 2016, especially in Brazil. Spread sexually and by Aedes mosquitoes, Zika causes little illness in humans. Its real horror was its impact on pregnant women. Microcephaly in particular can result from a Zika infection during pregnancy, causing major birth defects. Although less than 100 people have died from Zika, it has had a significant effect on public health and social stability in the affected nations. Globally coordinated public health initiatives and research helped to curb the epidemic. Zika demonstrated the erratic nature of viral development and the necessity of global surveillance, even for benign viruses, emphasizing the potential for widespread effects of epidemics. 19. Dengue fever outbreaks. Ongoing dengue is among the most common tropical and subtropical viruses spread by Aedes mosquitoes. Unlike influenza and Ebola, dengue has seasonal outbreaks. Dengue sickness kills 20,000 to 25,000 individuals worldwide and infects millions more. Should treatment not start right away, dengue hemorrhagic fever and dengue shock syndrome can be fatal. Urbanization, climate change, and more foreign travel all contribute to the ongoing public health concern dengue represents. Nations have created community education, coordinated vector control, and dengue immunizations. Although dengue is still prevalent in many nations, these strategies have reduced fatality rates and demonstrated the need of ongoing public health campaigns in controlling persistent viral hazards. 20. COVID-19, 2019 to 2023. We conclude by discussing the COVID-19 epidemic, which is currently undergoing upheaval. Originally discovered in Wuhan, China, in late 2019, COVID-19, caused by the novel coronavirus SARS-CoV-2, was then spreading worldwide. Although estimates of increased mortality point to a larger impact, the official death count is above 7 million. The pandemic has disrupted social interactions, devastated the economy, and swamped healthcare institutions. Governments all around imposed lockdowns, travel bans, and mask rules as scientists hurried to identify vaccines. Globally, vaccination campaigns have effectively brought COVID-19 from a pandemic to a controllable endemic condition, down from lessons in international cooperation, public health preparedness, and the value of research in stopping the next epidemics will define the legacy of COVID-19.